Hi, everybody, and thanks for taking the time to join us again today. Today, I'm speaking with Mario Machado. He's the National Practice Leader for Workplace Health and Safety Department within Aon Australia, which deals with risk management solutions, insurance and the like, and how to actually implement solutions that mitigate risks and how to better manage that. And Mario will do a great job at discussing that himself. So Mario and I discussed today workplace health and safety for remote healthcare workers and itinerant healthcare services, such as providing home care, on-premises healthcare services, online healthcare services, and some of the understandings that we sort of got to tease out of this in terms of occupational health and safety issues, workers' compensation in light of COVID-19, how to identify some of the risks, how to manage those risks. So this is a great topic if you're an allied health provider needing insights and guidance on how to manage risk associated with having a distributed healthcare workforce and providing settings from different locations that perhaps you've been used to prior to COVID-19. So there'll be some great insights. This will be a really valuable discussion. So let's jump in. I'll introduce you to Mario. Welcome, Mario.
Thank you. How are you going?
Good. How did I go with giving you a little bit of a summary background there? Do you want to tell us a little bit about what you're doing?
Well, you pronounced my name right, so people always get Machado wrong, so that's a good start. I think your intro was a good one. I guess just by way of a broad introduction into Aon, we're one of the world's biggest insurance brokers / risk management firms, and the practice that I manage in Australia is we're effectively a consulting business that helps companies with work health and safety solutions, incorporating a whole range of things, including compliance, due diligence, a lot of those sort of traditional health and safety things, through to other elements, including culture and leadership, mental health, and sort of leadership related issues. So whilst we're not really talking about that today, we're talking about COVID-19 and these sorts of issues. There's lots of elements around cultural things which might come in conversation later on.
Well, let's get into it. So, the world's changed a lot. Healthcare has been one of those slowly evolving into the online space and dealing with itinerant workforce. There's some sectors that are more prominent than others where the healthcare workforce is travelling out to locations, out to client sites, out to facilities. So tell us a little bit, how do you look at the context of the workplace? Tell me a little bit about how you and Aon kind of thinks about assessing risk and evaluating risk in that context.
Well, I mean, if we're talking about COVID-19 at the moment, and and it's funny that we're talking about this because it was only about 6 weeks ago we were talking about with clients, and I'm sort of talking general terms at the moment, but when you're talking to clients about the different workplaces, I think our perception of what that looks like has changed quite a lot in the last 6 weeks. People working from home, for example, has become a lot more relevant now than what it was a few weeks back, and some of the risks associated with that have really sort of changed in that period of time. But I think I think this particular your audience today is probably a lot more impacted in terms of what does a workplace look like, because it's not just within the settings of an office or what we normally call the traditional workplace, but if you're working from a client site, if you're providing, for example, physio services to a client out on site, then that's the workplace. If you're working from home and you're doing your consults via WebEx or Zoom, then that's the workplace. So, and that's how health and safety legislation is sort of written. Talks about the workplace, and I think that is now more relevant than ever, because where employers, including us, are having to really change the way they operate to ensure that they're delivering services to their clients and to ensure that our businesses remain that our businesses continue to operate, but doing it in a way that is safe. So that, you know, the whole definition of the workplace is changing somewhat.
So we're sort of so the workplace is somebody's home. It's potentially a car that they're transporting themselves to different locations. What should business owners and management teams within healthcare provider organisations be thinking about right now, especially in light of COVID-19 and some of the self-distancing and isolation that's been going on?
Well, look, you know, there's a few things that we sort of need to be thinking about, and there's lots of sort of commentary out at the moment around. I guess there's really two things that, you know, when we talk about COVID-19, we're really talking about, one, the risks of exposure to COVID-19, and in many ways, that risk for some employers has changed a lot in the last 6 weeks, and then for others it hasn't. But, you know, as the current restrictions around you know, particular workplaces and isolation controls and the like lift, then the actual exposure to COVID-19 risks actually exacerbate and increase. I mean, we're in many ways lucky that infection rates in Australia are fairly moderate compared to some of the countries overseas. But you know, the first thing that we need to be thinking about from a health and safety perspective is, you know, exposure to COVID-19, and what does that look like, and how do we manage that? And I can come back to that in a moment. But the other one is actually, you know, working from home, and the hazards and risks. And it may not necessarily be even working from home, but if you've got, you know, if you're on the line and you've got employees working in isolation from, you know, remote offices, for example, and they're on their own, a lot of these things here are applicable. So, and work health and safety legislation are applicable, both in the context of the exposure risks, and obviously the working from home scenario. So, but, you know, whilst a lot of the information that's freely available at the moment focus on how to reduce the risks of exposure, as well as, you know, what we're now talking about, working from home, and I'm using that as a broad umbrella. You know, from a workers' compensation perspective, you know, what do you do? And I don't mean to sort of not answer your question, but from a workers' comp perspective, what do we do if someone, you know, one of your employees contracts COVID-19? And if you go to the next page, you know, we've got a few slides here just to give you know, people some resources. But, you know, one of the tricky questions that we've been getting asked a lot is, well, if one of our employees contracts COVID-19, then are we liable for a workers' comp claim in that scenario? So, and this is a fairly sort of complex you know, arena, in particular if you've got people working from home and they contract COVID-19. But you know, in general terms, the usual rules that apply on liability of a workers' comp claim apply in this case. You know, first of all, is there an injury or illness? Has that occurred? And under current workers' comp laws in every state, the definition of an illness would include diagnosis of COVID-19. And the other one is around the exposure. Well, did the exposure of COVID-19 occur in the workplace? So, and you've got to think about, well, you know, what does that mean if I've got an employee that's working from a client site and has to get to the client site and back and forth? Is there a possibility that the exposure occurred even getting to the client side and vice versa? So these requirements in, you know, what we call, you know, determining liability are applicable in this case. But, you know, but obviously, you know, in establishing in the course of employment, you know, this is even more difficult if someone contracts COVID-19. But the locations to which that individual would have been exposed can be multiple in multiple locations. So, you know, how do you determine it then? And that's where it just gets, you know, more and more complex. So from a workers' comp perspective, you know, ultimately every claim will be determined on its own individual merits and the circumstances associated with it. So, but we get a lot of questions in this space, and I think this is a really relevant one for this particular cohort, you know, of people dialing into this, you know, this call.
So that presents some interesting intertwining kind of issues, because on the one hand, if a health practitioner is working from home and providing online services such as telehealth, healthcare services, and the employer hasn't asked them to attend any other physical location, but that practitioner becomes exposed to COVID-19 through their own social interactions. How does that? Is there a crossover there? Is there some sort of what can an employer do to actually do things reasonably that kind of sets out what the direction is that's being provided to the individual, so that it can be clearer, perhaps, where somebody has individually caused themselves to be exposed to something like that or caused themselves to suffer an injury, as compared to doing it at the direction of their employer?
Yeah, so look, so there's really two things here. One is the issue related to exposure to COVID, and let's say someone who contracts COVID-19, but that individual hasn't been outside of the out of the home, but they've been asked to work from home, and they've been exposed to COVID-19 potentially from a family member in the course of them doing their their workplace. The question mark will be, did they contract that whilst they were at work, even though they actually contracted it from a member of the family? So, we haven't had any cases that in line with that. So, the the case law around this sort of we're still waiting for the first case to determine exactly how will liability and the claim be determined on this basis. So this is really the the complexity around this will be in determining liability. I think it'll be a lot easier with workers' comp claims that aren't necessarily related to COVID-19. So if someone is obviously working from home and they incur an injury as opposed to an illness that is related to either their ergonomic setup or they actually slip, for example, in the course of them working from home and incur an injury, then that's a lot easier to determine liability on. But the ambiguity around determining whether the exposure to COVID-19 in the event that someone does contract it occurred as a result of them working from home, which they were asked to do, then that's where it gets really quite complex. But ultimately, at the end of the day, liability on every claim will be assessed on its own merits by by the agent or the insurer. So it's a bit of a it's a bit of a tricky one, because we don't have any case law to give us any more clarity on exactly which circumstances will result in a claim. I think the key thing to point out is that there's definitely liability on employers, and we probably need to do all that we can to try and reduce exposure, and provided that we do that as well as we can, as far as reasonably practicable, then the risks of it becoming a claim are reduced. But even if if an employee does contract COVID-19 and they're entitled workers' compensation, that's I'm not suggesting that's a bad thing either. The scheme is there for a reason. It's there to protect workers if they need the help, but it's really around just giving employers that clarity on what did the rules look like. And I'm an employer, I'm trying to do the right thing, and what are the things that will then determine liability on the claim. So it's about understanding those issues.
There's so many layers to this, because on the one hand, yeah, great, okay, there's workers' compensation, and so there's an element of financial risk transfer there, where paying into the workers' compensation scheme provides support in the event that an employee needs to claim against it. But then you have these kind of parallel issues, and one of the questions that was in my mind as I was sort of working through that in my own mind is, so let's say, are there certain risks that workers' compensation in of itself doesn't cover, and so that would then be either a direct financial ramification to the employer, or would warrant some additional type of insurance to be able to actually deal with it, or perhaps can't even be insured away. It's a full risk that actually falls on an employer.
Yeah, I mean, I should probably say from the outset that I'm not a workers' comp specialist or an insurance expert, but in general terms, though, workers' compensation, covers the loss of earnings and the medical and like expenses associated with, an injury that occurred during the course of employment. So and that's just what workers' compensation does.
What I
and
was sort of more getting at is that when there is something insurable like workers' compensation there that can cover, the cost for the employee, it doesn't necessarily take into consideration what the losses are to the employer. In
to
other
the
words,
business.
yeah, exactly, because you've been in a situation where the team may have been contracted back, some people may have been stood down, some people may have been made redundant, and so you've gone into the tightest possible configuration you can in terms of your what you can support in terms of cash flow and costings. And so if somebody now it becomes unwell through COVID-19, or perhaps falls over a rug that's in their own home, in their home office, quote unquote, and they're out of action for a while, well, that's got to be something to think through as well. It's what would the issues be there? That's kind of what I was trying to get at. What are the we got insurance for the employee, but what happens to the business when that employee is out of action for a while?
Yeah, that's really relevant if you're a small business where the things that we're talking about could potentially impact on the business unable to do what it needs to do. So, and again, I'm not an insurance specialist, but there are a whole range of insurance products that do cover things like business continuity, and there are, depending on your insurance policy, there are certain exclusions that you need to look at to see whether COVID-19 would be covered under your policy. So our recommendations are to talk to your insurance broker and just see, one, if you're covered, and then two, if there are any exclusions, to make sure that, okay, well, if I run a small practice, for example, and there's a small cluster of COVID-19 infections, and I'm unable to sustain the business for a period of time, then what sort of protection have I got? So that's a really important question. And in fact, if anyone is interested in learning more about this stuff, we did a webinar on this very topic, and if you can probably Google it, but if you do COVID-19 webinar Aon, you'll probably get access to that webinar. There's a whole range of topics on that particular issue around insurance, so that might be something that you might want to look at. But so I think the answer to your question is there are definitely insurance products around business continuity. And if you don't have that, I'll be looking at it as a business. And if you do have an insurance product that provides that sort of coverage, I'll be asking your insurance broker to clarify that you'd be covered under the current circumstances.
All right, so I just put a link out through the comments feed for that particular site. So, all right, Murray, sort of coming back into your wheelhouse then. What are some things that you'd be recommending or perhaps suggesting to business owners at the moment to work through in terms of risk mitigation strategies?
So look, I think there's really there's two or three areas that I'll be focusing on. One, just going back to what I was talking about earlier. One is about the exposure risks, and you've really got to look at what are the particular tasks or activities or processes in my business that could potentially result in exposure. So if you've got people working in a clinic where they come into contact with the general public, how do we sustain, or how do we get those separation processes in place? And a lot of this information, to be honest, is freely available online. And I think even in the last 6 to 8 weeks, we've learned a lot about that. But looking at social isolation strategies, if you look at the hierarchy of controls, if you can eliminate the exposure by doing things like working from home, then I'll be looking at that. Like my mum, for example, her specialist does her appointments by Zoom now. I don't really want mum going into a clinic to do an appointment with a doctor, so we're doing all that by Zoom. So I'll definitely be looking at that as, in terms of the hierarchy controls, that's your first option. And then if that's not an option, I'll be looking at, obviously, trying to stagger the number of people in the workplace, making sure that they can stick to the isolation guidelines, 1.5 to 2 meters away from each other, and really looking at things like hand sanitizer and possibly even gloves and masks. There's lots of conflicting information around the use of, say, gloves and masks, but the use of hand sanitizer is critical. It's really, really important, and I think most people on the line probably know a lot more about this than I would. But from a health and safety compliance perspective, what the employers recommend is that you do a risk assessment. So by doing a risk assessment and looking at all these things, then you can, if you work through all your risks, then you come up with, okay, well, these are all the various risk control strategies that we'll be implementing in our business to reduce that risk. But something for us to think about over the next couple of months, as hopefully some of the restrictions that are currently in place are lifted, is even look at things like staggering start times, so that you don't have everyone coming into your workplace all at the same time. If you're an employer that has employees going to client sites, for example, so let's say you've got a physio that goes into a manufacturing business, try and stagger those clinics to reduce the exposure frequency, for example. They're all little things that you can do to really try and reduce that exposure as much as possible. So I think that's the in terms of exposure, that's what I'll be looking at. I think all this information is sort of readily available. But then in terms of for those that have got people working from home, again, I think, to be honest, I think this is probably one of the biggest issues facing many employers. And again, 6-7 weeks ago, working from home, I think some people thought that this would be a short-term thing, but certainly this is becoming, a practice that's likely to be sustained for a lot longer than the last 6 to 8 weeks. We've been working from home now for about 6 weeks, and the first 3 or 4 weeks, I actually thought this was pretty good. I was pretty efficient. I was getting through a lot of work. I was enjoying not traveling. I travel interstate a lot, but we're 6 weeks into it, and I'm becoming a little bit, I'm getting a bit of cabin fever. So, really looking at things like activation strategies to combat social isolation, doing regular check-ins, WhatsApp and other social media groups, looking at things like job design changes where possible. Can you change the way the individuals do their job? And in many cases you can't, but that's something you'd be looking at. Web-based tools to help manage, isolation. So what I do with my team, I've got a team in every state. And we've got WebEx tools. I do regular check-ins with the team. We have virtual drinks on Friday night. And again, 6 weeks ago, this was pretty innovative, but now it seems like everyone is doing it. So, this in itself is not new. But I think as these current practices remain as they are for longer, definitely some individuals are finding it more and more difficult. So okay, that are really struggling to look at specific advice for them, and even potentially getting clinical assistance for those that really need it. And I suspect there'll be people on the line right now that specialise in this. For those who are advocates of meditation or mindfulness practices, I highly recommend meditation. It's just it's a really good way of getting away, thinking about what the future holds, and really focusing on what's happening to me right now and being really in touch with how I'm feeling. So promoting mindfulness practices is really, really important. And I think from my perspective, and in particular, a lot of the workplaces that are implementing salary reductions and the like, and creating uncertainty, is just really being positive about what the future looks like. At the end of the day, we're all in this together. I don't know anyone who isn't impacted by what's happening at the moment. So just maintaining a really positive outlook, as naive as it sounds at times, I think is really, really important. And in particular, the role that a lot of people on the line right now play in this whole pandemic is such an important function, during, a crisis. I think it's important just to remind people what we're here for and the importance of the roles that we're playing. I think that's really important in just keeping everyone centered and focused on these sorts of issues. So then all of a sudden, some of the the things that are creating uncertainty and anxiety, because we're all working from home, probably working a lot harder than what we normally do, become less critical. Well, it works for me anyway. Just really keeping a positive outlook, is really helpful.
I think mindset is critical, and also, yeah, that sense of connection and staying in touch with people. Social distancing, unfortunately, kind of takes us away from one of the most important things to our health, and that is our social connections. And being connected with the people around us, and touch is a really important part of that. So, yeah, it's interesting how you were sort of commenting that there seems to be this kind of trend that's happening where we're all doing the Friday, virtual drinks, and we're all finding other ways to kind of retain that and keep it going. So there seems to be sort of an organic desire to do that, which is good.
Yeah, look,
Sorry, go on, Murray.
Yeah, look, I was just going to sort of, elaborate on one point. Whilst I focus a lot on the emotional aspect, then, one thing that I think, we're perhaps not talking enough about is the physical side of things, and that's ensuring that you've got a decent setup at home, because
Yeah, let's talk about that. I think that's an important consideration, because everybody's home is their own castle, and how they design it and how they implement it suits their own personal needs. But now there's a workplace setting there as well. Is there a boundary? Is it the room that's designated for work? Is it from the front door all the way through into is there some definition of that? And if it's not your expertise, I understand, but it's kind of it conjures up in my mind as sort of where is the distinction now, and what can an employer do to actually quality control some of those environments?
Well, again, it's a little bit ambiguous, but ultimately the workplace is all of those. So if that means that you have to walk into your house to get into your study to work, then technically that's the sort of boundary of the workplace in this context. So that's if an injury was to occur within that workplace, then again, not only is it compensable from a workers' comp perspective, but it's something that we as employees need to be looking at. So, and I mean, this is a sort of, I could talk about this for about 2 hours, but ultimately the only way to quality control this is to encourage everyone to do a work health and safety assessment. And there's lots of checklists that you can get from the web. There's lots of different ways to do it, but at best, just ask everyone just to do a quick assessment of of how they've got their desktop set up, and to try and get a decent setup where whereby you've got particular practices in terms of your workstation set up well defined and clear. And there's lots of guidance available online. All the regulators have got lots of information about ergo setups, and the like. But this is becoming more and more of a challenge, because when we've got people working from their kitchen benches at home, younger staff, so they haven't necessarily got an office like mine, for example. And what do you do then if you've got someone who's working from their home, which is a one-bedroom apartment in the city? And that's the challenge, is how far does an employer go to ensure that they're providing a safe workplace when the individual just doesn't have the right setup at home? And that's where it becomes more of a challenge. And I've got clients that clients are providing monitors, providing salary sacrificing provisions within the workplace to encourage workers to go and buy better equipment, for example. I've got one client that actually even allowed an individual to go and buy a proper desk and a workstation, because that individual was really struggling and had an existing back injury. So they're the sort of some of the things that employees are doing. It's not necessarily a requirement, but the law just says you must provide a safe workplace as far as reasonably practicable. And in demonstrating what is reasonably practicable, you need to strike that balance and establish that yourself. But that physical element is really quite challenging, and I wouldn't underestimate the importance of having a decent desk set up and making sure that you've got a chair set up at a certain height and monitors at a certain height, that you're not slumped over. Excuse me. That's and I think I'm preaching to the converted, because a lot of people on this call, professionals in this space, but that is a real issue. If we're looking to be working from home for another 3 to 6 months, then this is really quite important.
That's an interesting one. And all right, so let's move it forward a little bit. So we've had restrictions now. There's flattening of the curve. You know, the one of the objectives there by government is being monitored, and at some point we're going to start relaxing those, and so you know, there'll be parts of healthcare that for the time being are not going to the clinics and the practices. There are other parts of healthcare that have continued to do that. So when you have kind of made that decision as a healthcare provider to keep everybody at home and deliver online healthcare services, video, voice, instant messaging, perhaps doing other work-related activities in the meantime, what would you suggest would be a reasonable approach? I think you were going there a little bit earlier with the staggering approach, but what would be an answer to somebody, to an employee, for example, saying to their employer, you know, I don't feel comfortable going back yet, or when should we go back? How are we going to go back? Have you seen any examples, any thought bubbles occurring on what people think would be a reasonable way to do that kind of, you know, go back to in-clinic services?
Yeah. Look, it's a really important question at the moment. My wife's a teacher, so we have this conversation almost on a daily basis around, you know, how do you establish when it is safe to go back to work, and how do you manage the risks? And again, I think, you know, this is, you know, when we say this is an unprecedented event, it really is. You know, we're all kind of learning on the go, to be honest. But you know, what I'd be doing again is just I would be doing a risk assessment and determining, okay, well, if we're looking to return back into the workplace, again, what can we do to reduce the risks? And if that means sort of staggering things, then, you know, then so be it. I mean, you know, again, I'm not a health specialist, but the information that we've been, you know, told is that until the vaccine is out, ultimately this virus will be in the community for, you know, for a long time. So there will always be a risk of exposure. To what extent, I don't think anyone knows. For how long, I don't think we really know. So I think maintaining all of those controls that I mentioned earlier will be BAU. I think it's just, you know, it'll just always be the case. But in terms of people who are now working from home, and then getting them to return back into the, you know, real workplace, where potentially there will be an exposure, but then you've got an employee potentially who's uncomfortable in doing that. You know, it'll be a challenge to try and work out, well, you know, how do we do that? So I think the first thing is sticking with the facts, and let's control the risks as much as reasonably practicable. And if you do that, then I think, and if you talk to your workers, then I think in most circumstances there shouldn't be any issues. But you do need to look at the circumstances of the individual. If you've got you know, an employee who's got underlying health conditions, then you need to assess that individual's needs separately and differently. And if you've got someone who's unwell and does not want to be at any risk of exposure, then you know, you ought to consider that. And health and safety legislation allows for those provisions. Now, I'm not an employment lawyer, but if, you know, we get involved in these things regularly, but, you know, I think there'll be, you know, an employer needs to be reasonable in managing some of these restrictions and needs. But you know, I think again, how employers in this sector deal with this over the course of the next couple of months, you know, will vary. And, you know, to what extent do employers, you know, get to a point where they require employees to be working from the office, where there's a definite potential risk of exposure? That sort of remains to be seen, to be honest. You know, I think that I think if, you know, just applying some good leadership and management practices, I think if you're open with people and you talk about it, and you want find out how the individual is feeling about it, and then address any concerns on a case-by-case basis, I think in most cases you'll be fine. You know, I myself have an employee that went out to a work site today, and that's the first site visit that we've had since the lockdown, if you like, and we did a risk assessment. We looked at all the potential routes of exposure. I spoke with the individual. She was very comfortable in approaching it the way we did. The client was very accommodating. There was no cases of COVID, and on that basis, we made the decision that it was safe for her to go. And I think that's what we need to do. I don't think, again, I don't think there's a silver bullet. I don't think there's going to be a particular formula that we all have to sort of follow. But they're the sort of factors that we all really need to consider in the next few weeks, next few months.
So, so that's good advice. So obviously, always. If I could sort of summarise it, what we're talking about there is basically stay connected with your team. Regular contact, check-ins, find other ways to keep that connection going, and see how they're doing from being at home the whole time, or potentially how they might feel about being asked to go to a particular site to provide services, whether it's an individual or a group, and work with them. Would there be any other evolving guidelines, or perhaps some references that you're seeing in the industry where perhaps a best practice approach to how to deal with this is evolving, that there's kind of people feeding into it at this point in time. It's sort of coming together as a guideline. Are you seeing anything like that in the industry?
Yeah, look, a lot of different industries are producing their own guidelines at the moment. So, and it is a bit of a moving target. So, if you look up all the regulators, all the work health and safety regulators are producing lots of different material, both on health and safety and workers' compensation. So, and I imagine over the next few weeks that those guidelines will evolve to allow for some of these things that we're talking about now. So I'll definitely be doing that. And then I'll be looking at, perhaps even some of the industry associations. And, there's a couple of different industry associations in this particular sector. I'll be looking for them for guidance as well. And even organisations like Aon, we're producing guidelines on a regular basis to accommodate some of these changing guidelines that are being rolled out. And even in the absence of something in your particular sector, looking at other sectors like the education sector. The education sector is having to deal with this very issue at the moment around, okay, well, if we're looking to bring teachers back into the classroom, as there are now, how do we manage this on an ongoing basis, and how do we sort of scale it up over the next few months? So I highly recommend that everyone just really keeps abreast of all of those guidelines, because they are changing almost on a daily basis.
So I'm going to post a link from from WorkSafe, although it is a Victorian site. Presumably there's some crossover with some other territories as well. So I guess just a couple of things before we trail off. Aon, it's a big brand in the insurance sector. I've provided some links on how people can contact you, Mario, as well as find out more information about Aon. Do you want to give us a 30-second rundown on how you would help when people contact you, and what they could expect out of engaging you?
Sure. Just using the examples that we've been talking about in terms of working from home, we've got lots of free stuff that we've been giving to our clients, both in terms of webinars, in terms of fact sheets, brochures, different types of guidelines, and lots of different material. So for those that just want some free guidance material, there's lots of tools that we've been producing over the last 6 weeks, and that's available to most people, obviously clients. But where it gets a bit more complex, we work on a sort of client by client basis, where we establish what their needs are and then help them implement either strategies or solutions, or come up with different ways of dealing with things. We know whether it's more the physical working from home stuff, or even things around the mental health stuff. We've got a lot of clients that we're working with at the moment around, we've got people working from home, geographically spread all over the countryside, and we're really seeing an increase around mental health related issues, and can you help us with it? And we help them both in terms of strategies, in terms of specific interventions to reduce risk, and things like training and education. So we deal with every company based on its individual needs, and we do that right across the country.
Fantastic, Mario. And one last question. COVID-19's kind of, triggered a lot of change at the moment and a lot of adaptation. So where do you see workplace health and safety going forward? Let's say post a COVID-19 kind of area that we're in at the moment. What's your view on it 3 to 5 years out? What are the key issues? Are we all working from home? Are we a hybrid? Every industry is somehow hybrid with workplaces at home that persists and continues. What are your thoughts?
Yeah, I think the world has definitely changed, and I think we've just proven over the last 6 weeks that traveling interstate every week like I was before is not necessarily a necessity. So I think workplaces have changed. I think the way we operate has changed. And I've just used one example in terms of travel. I think we've proven that technology, people have adjusted. So I do think that some of the things that we're currently doing will become a lot more acceptable in some workplaces, and I think society in general is becoming a lot more accommodating of that and comfortable with it. And I actually think that's a good thing in general. What I don't know is how long lasting some of these economic conditions are going to last for, and how much uncertainty that creates in people. So that's something that is a bit of let's just see what happens. One of the things I'm predicting, and I think this is relevant for this particular group, is a lot of people that would have been thinking about retiring in the next 2 to 5 years are potentially going to hold back on retiring because their investment returns have taken a dip. So potentially we're going to see our aging workforce becoming a little bit older, and I don't necessarily think it's a bad thing. I think it's good to retain some of those really experienced workers, but in terms of our clients, because we all work in this sector, we're dealing with a mature workforce. I think we're going to see the risks associated with that workforce become more and more evident in terms of injuries in the workplace. So that's one to watch out for. But I honestly do think that mental health has been an emerging issue for a while. I think it's emerged. We're there, and I think that the next couple of years are going to be probably a little bit scarier in that context.
I actually see a fantastic opportunity for healthcare providers to actually help each other. Where it might be mental health providers are supporting non-mental health care workers, and physical therapists are supporting home working healthcare practitioners, and so on and so forth. So there's kind of a supportive ecosystem that can develop there, which could actually then extend into clients as well. My take on it, for what it's worth, is I actually think that we don't go backwards from here. I think just the percentage, there will be a trade-off between, maybe at the moment in some areas of healthcare, the trading slide has gone all the way to online, or perhaps it's at 60-40 or 70-30. But I imagine going forward that with Australians now experiencing the utility and the ease of being able to gain access to healthcare providers online, not to say that it replaces in-person services, but it enhances and augments. And so I see a hybrid version of healthcare. I definitely see it as a reimagination event where the healthcare model is not just a small percentage of healthcare providers that are providing telehealth and telemedicine as an example, but now kind of everybody's got the capability. And slowly but surely that will start to feed into some of the management challenges, of which, occupational health and safety is definitely one of those, and sort of understanding that having a distributed organisation with your workplace is no longer the address you used to think it was. It's everywhere your team members work from and work within. So being able to think that through, come up with good quality systems to be able to support it, keeping everybody connected in with that process as well, so that there's actually an iteration process where team members are feeding back to management are feeding back to team members. There's kind of like an evolution that's going on. And I know within the healthcare sector generally, there's a lot of communities, a lot of forums where there's discussion going on around these kinds of things all the time. So I can see that making progress quite fast.
Yeah.
And then sort of, tying in how the consultation and some of the products like insurance can work to actually support it. So I kind of, even though we've been talking about risk today and we've been talking about some of the downside of it, there's actually a lot of upside. And we have to be mindful that, yes, somebody might get injured, somebody might get sick, and it will be a workplace issue. And so we've got to have a process for that. We've got to be able to deal with that and be on the front foot with it to the best that we reasonably can. But by doing that, we actually equip ourselves to transform the way that healthcare is delivered going forward, and that could open up a tremendous amount of opportunities.
Yeah, look, I agree. I think there's an enormous amount of good that comes out of difficult situations, and I think that's what you're describing there. I think we can operate in a whole different way, and I think we've just proven it over the last 6 or 7 weeks. We've all pivoted to working differently, and it's working. And I think I think both in terms of the workplace, but I think this particular the health sector can definitely play a huge role in helping society. So there's lots of positivity around this particular group, and I think employers are in general adjusting really quite well.
Now, we've had a question from Carlos just talking about why government isn't helping more with a money list for 2 months of bills. So I'd probably suggest, Carlos, get in touch with your accountant and explore some of the stimulus programs that are around that might be able to help you, whether you're a sole proprietor or an employer, and whatever legal structure that you're actually in. There are quite a few programs, and don't just look at federal opportunities, look at the state that you actually live and work in as well, because each of the state governments have been allocating budget towards their own jurisdictions as well. And you might be surprised. And consider also, if you are dealing with the taxation office, to try and negotiate better payment terms for yourself as well, there, Carlos, over a period of time. Potentially look into payroll tax if that's something that you're paying for at the moment. There's quite a few resources that are in place now. Whether it's going far enough, long enough, I definitely I will leave that to other people to sort of work through. It's more a political discussion, but there's definitely a lot of initiatives out there that I hope you can get access to and sort of sort yourself out there, Carlos. With that said, Mario, I just wanted to thank you once again for taking the time to come on board. I think it's a really timely discussion. I think it'll be a discussion that'll pick up steam in the community as the awareness and the thoughts start to go towards, okay, we're distributed, we've got a workforce that's all over the place, and potentially we may be recruiting going forward as well in different states and territories as well. To deliver healthcare. So it's a very worthy discussion, and I really appreciate you taking the time. Your links are in the comments and also in the posts for these video broadcasts. And thank you on behalf of everyone that's been listening, and will continue to listen. Thanks, Mario.
Thank you, Yianni.